everyone. Okay, so I'm about to give my persuasive speech, and here is my audience. I've got 6 people here to watch my speech, and then let me real quick. All right, should be able to see me well. Okay, so I'm going to talk about physician-assisted suicide today. I think it's a really interesting topic. So here we are. So imagine this is Nancy, and she's got terminally ill cancer. Imagine you're just like Nancy, and you're facing endless suffering and excruciating pain of death. Your doctor has already informed you that your days are numbered, and any day could be your last day. You lie awake at night in discomfort and feeling tortured by your disease. You're miserable and in desperate need of terminating your agony, but you have no one to turn to. You can't ask your beloved loved ones because that would put them in a really hard predicament, and you can't ask your physician because they can't do anything for you about it. Your last resort is to ask your doctor, but again, they can't help you. It's stunning that when people are facing death in their darkest and most desperate moment of life, nobody can offer a solution to their suffering due to laws that ban this request. Passing a law to legalize physician-assisted suicide or suicide committed by someone suffering from a severe illness with the assistance of a physician would help patients to die in a good state of mind before they lose control of their body, where they're no longer able to speak or control their motor skills. As a nursing student, I've witnessed the suffering that terminally ill patients or elderly patients who are no longer able to control their body experience. I've watched them both ask me and their families and physicians that they no longer want to live, not only on one but multiple occasions spread apart at various times in the day. And this is really hard to see as a nurse and as a physician. I only hope that if I'm ever faced with this terminally ill illness, that I would be able to ask my physician for help. If one day any of you encounter this misfortune, you might want to explore the option of physician-assisted suicide, which is why it's so important to know about this matter and to be an advocate for it. Today, I will prove the need for physician-assisted suicide by explaining the qualifications needed in order to undergo physician-assisted suicide, states that are already practicing physician-assisted suicide, as well as real-life examples of people in this horrible situation that need physician-assisted suicide. More and more people are suffering from terminal illnesses. It might be from the chemicals that are in our foods nowadays, or just some weird environmental factors, and we really don't know that, but it's becoming much more common. And some may need to be able to escape their illnesses. According to the New England Journal of Medicine, there have been several accounts in which a patient was suffering and has ended their own life and left their family distraught, and as they didn't expect this. For example, Dr. Angel, who will be mentioned later in this speech, was faced with this horrific incident. Her father, who had prostate cancer and so much pain from it, and it was intreatable and terminal, had to kill himself just by a gun that was in his bedside table for years. And this was just done due to how much pain he was experiencing and the fact that he knew there was no way out and there was no treatment. In other cases, a family member or a close friend has helped to end the excruciating pain and suffering to their loved one, and they end up facing jail time for what is considered murder. This is startling because it's likely someone who really loved this person is going to end up in jail just because they could see how much they were suffering and they were really just trying to help them. If physician-assisted suicide was an option, neither the patients nor their families would have to endure this trauma. Patients and families are not the only ones who are affected by not legalizing physician-assisted suicide. Doctors and healthcare employees are also witnesses to physician-assisted, or to this terminally ill patients. And they witness this, and it's really upsetting to see a patient suffer and watch them suffer and hear them want to not be here anymore and just want to be able to hold their families' hands in their last minute, but they don't know when this is going to happen, besides within the next X amount of days or months. According to an article in the New York Times, Dr. Jack Kerouac illegally practiced physician-assisted suicide throughout the 1990s. He spent 8 years in prison after being convicted of second-degree murder and the death of around 130 patients whose lives he ended, humanely in his views. And he just did this because he knew his patients were terminally ill and he knew there was no treatment that could help them. It would only cause them to suffer and extend their lives only a short amount of time. And they wouldn't be, they aren't healthy right now, but they wouldn't be comfortable and they would be sick due to these medications and treatments. He wasn't a bad person, and he didn't deserve this great injustice that was served because he was really only trying to do right as a physician by putting his patients and their desires first. Today I'm going to share the story of a 29-year-old woman named Brittany Maynard. She's come to light according to KTLA Channel 5 News of Los Angeles, and this is a little bit of an old story, but I thought it was a really good one and very valuable. She had recently been married and diagnosed with brain cancer while on her honeymoon with her husband. She was given 10 years to live, but eventually the terrible news that her brain tumor had progressed to glioblastoma multiforme, which is the deadliest form of brain cancer. Her life expectancy was then shot down to 6 months. After being informed the time she had left would be slow and painful, she wanted to end her life peacefully with her family by her side. She then had to move from San Francisco to Oregon in order to be eligible for the state's Death with Dignity Act. She spent her final weeks advocating on behalf of life rights advocacy organization Compassion and Choices for Death with Dignity laws to be enacted in California. While being faced with something so drastic and so terrifying, I believe that patients should be granted the right to end their suffering if they wish to, and if all other options have been used. They should not have to go through the agony that awaits them at the end, and they're going to face the same results either way. It's just how much suffering are they going to go through until they hit that point, which is death. Maynard stated before her planned death on November 1st that she hopes to enjoy however many days she has left on this beautiful earth. The reason to consider life and what's of value to make sure you're not missing out. Seize the day. What's important to you? What do you care about? What matters? Pursue that and forget the rest. This really shows that she was mentally competent and she was a great advocate for this matter. This is something that her family will always hold dearly as they're able to remember the good times with her and how she was able to impact and make a difference and go to rest peacefully. Now, not everyone who wants physician-assisted suicide shares their story like Maynard did. Her video actually was a YouTube video that kind of went viral, and I think it's really good that this matter was brought up at that time. Now that you should understand why it's necessary to legalize physician-assisted suicide, let's move on to what I believe to be a solution, which is legalizing physician-assisted suicide. An exact consensus on the qualifications that need to be met in order to take part of a physician-assisted suicide have yet to be determined. There are several things that should be faced in order to be suitable for physician-assisted suicide. According to Michael White, the option of physician-assisted suicide would arise only after all treatment options are exhausted, the best of hospice and palliative care have been failed to relieve unbearable suffering, and if mentally competent patient continues to request the assistance in dying. So this means all options have been met and nothing is working. Then with the agreement of an outside opinion, a physician would be permitted to prescribe medication to that patient to use when they decide to die at their own timing. This means the doctor provides the necessary means and the patient is the one that actually performs the act. For example, they would get a prescription and have that pill bottle with them, responsibly educated on how to keep it and what to do, and they could do it at their time as they wish. The University of Illinois at Chicago College of Medicine compares it to anesthesia, but says it's different in that anesthesia, the physician actually performs the intervention, where with this, the patient would do it on their own time. The legalization of physician-assisted suicide, according to White, would lead to the reduction of patient and family anxiety about future suffering and death. And care and comfort at the end of life would be improved because the patient and the families would be prepared for the death and they don't have to dread waiting for the unexpected day of when is this going to happen. It's not only physician-assisted suicide isn't only a way to end patients' and families' pain and suffering, it's also a cost-efficient alternative to excessive life-saving measures. While this does sound terrible in a perspective, if you think of it in the way that these treatments might be extending their life only for a short period of time, they're not going to feel well during this time, and they aren't going to be doing anything that they normally would have been doing prior to this diagnosis or this treatment. LaPuma stated that managed care and managed death through physician-assisted suicide are less expensive than fee-for-fee service care and extended survival, and less extensive is better. And remember how I kind of just explained it's not as gruesome as it sounds. Now that I've explained the main qualifications to become a candidate for physician-assisted suicide, which is a possible solution, and the economical benefits, I will continue to convince you of this practice is a good idea by discussing the implementation. All of the states that have legalized physician-assisted suicide, which is currently 7, share similarities in their legal protocol according to the state-by-state guide to physician-assisted suicide. In order to be eligible, patients must be of 18 years of age or older. They must be a resident in that state. The patient must be capable of making and communicating health care decisions on their own, as well as having diagnosed with a terminal illness that is giving them a life expectancy of less than 6 months. The attending physician must also be licensed in the same state as the patient, and the physician's diagnosis must be certified by a non-consulting physician, which would mean someone that hasn't seen the patient and they see the patient, so there's no bias to it. And they must notify the patient's next of kin about the prescription, as well as a few other things. In addition, the patient must have 2 oral requests at least 15 days apart, followed by 1 written request. This is so that they're cognitively aware this is more than one wish. It's not just a moment of sadness. It's a constant need and a constant suffer that they would like to end. And all of this information can be found in the state-to-state guide to physician-assisted suicide. I feel if a patient's willing to put forth this much energy to request it over 15 days apart and write it writtenly, that really shows that they're suffering and that this is what they want. I feel like that really solidifies that. Today I've demonstrated the need to legalize physician-assisted suicide with the use of real-life examples of people in this horrible situation that would be benefited by physician-assisted suicide. I've explained the qualifications needed in order to undergo physician-assisted suicide, as well as the cost benefits. And lastly, the implementation of physician-assisted suicide in several states that are already practicing this matter. Understanding what those who are tormented with the suffering of a terminal illness go through will help you to understand the necessity of this law, and it's really unpredictable who might end up with a terminal illness. So if you feel that this really doesn't matter to you, you never know what's going to happen the next day, and that's why it's really important to pay attention to this matter and to be an advocate for this matter, because one day you might end up wishing that this law was a law in your state, so you don't have to move to another state like other people have. Put yourself in a suffering patient's shoes. Imagine how terror-stricken you would feel and how much you would wish to be put out of your misery. And remember that legalizing physician-assisted suicide would result in patients being able to die happy with their family members by their side and not having to watch them suffer this horrible last stage of life that they would face. Thank you. And do we have any questions? Has anyone had a family member that was terminally ill and that you feel that they maybe would have benefited from this? I know it's a very big topic. Okay, well, thank you for watching today.